So my presentation is on the health and economic effects of legalized gambling. And so an overview of gambling. The first casino to be opened on the Las Vegas Strip was the El Rancho Vegas on April 3rd, 1941. The first legal casino on the eastern seaboard opened in Atlantic City on May 26, 1978. And in 1987, the Supreme Court removed almost all restrictions on casino gambling on Indian reservations. And as a result, Congress then passed the Indian Gaming Regulatory Act in 1988 to try and regulate the industry a little bit. And then going on to Native American gambling, Native American reservations have some of the highest rates of poverty and drug abuse in the country, so many of the tribes jumped at the chance to make lots of money through gambling. Although many people argue that legalizing gambling can increase local economies, others argue it can lead to increased cases of pathological addiction to gambling, increased crime rates, and increased drug abuse cases. This could lead to increased healthcare costs and create a heavier burden on local governments or the tribes themselves to pay for more law enforcement and addiction prevention programs. And also, this session in the Georgia legislature, gambling was the most the heaviest lobbied for idea, and it didn't even make it out of subcommittee. So it's very relevant to us today. And then honing in on gambling on Native American reservations. With the rapid spread of gambling operations on Native American reservations, there is concern that gambling will in fact make the conditions on the reservation worse off. By legalizing gambling, the tribe could either decrease poverty and use funds to better reservation conditions, or it could potentially increase the number of addicted individuals and lead to greater levels of crime and drug abuse. So the question is, should Native American tribes legalize gambling, and will this help or hurt their reservation? And so the article I looked at is The Income and Health Effects of Tribal Casino Gambling on American Indians by Barbara Wolf, Jessica Jakubowski, Robert Haveman, and Marissa Curry. And the authors seek to discover the effect of legalizing gambling by Native American tribes on both income levels and health behaviors. The authors hypothesize that Native Americans on reservations with gambling will have higher incomes and as a result better health access and behaviors than those who are on non-gambling reservations. And so the authors use data from the Behavioral Risk Factors Surveillance System for individual Native Americans, and they choose to look at the individual and tribal levels. So for the tribal level data, they get it from the Evans and Topolesky study in 2002. They use a difference in difference framework to compare outcomes between individuals with and without gambling on their reservation, as well as compare the before and after effects of legalizing gambling. They use a structural two-stage multiple regression model to accomplish this, and evidence of an effect would be an increased income, most likely through direct tribal payouts from those in charge of the gambling reservations, as well as changes in reservation infrastructure and changes in health behaviors by individuals. And so this is the graph. I'm sorry that my screen kind of blocks it, but basically this graph is a difference in difference summary of some of the other graphs for before and after they've legalized gambling, and I summarize the results of that graph on the next page. So the results are the mean effect of legalizing gambling for Native American reservations is a $1,750 or a 5.3% average increase in household income, and this number is statistically significant. They find an increase in mental health on gambling reservations, but only anxiety is statistically significant. They find no correlation between legalized gambling and employment levels, and overall, the increase in income from the legalization of gambling leads to better health behaviors. Some examples of this is a 9.6% decrease in smoking, a 7.3% decrease in days identified as anxious, a reduction in the probability of heavy drinking by 5.2%, and a reduction in obesity on average by 2%. And all of these numbers are statistically significant. So the result of this study shows that increased income levels among Native Americans due to the legalization of gambling lead to less risky behaviors and better health, whether that's due to increased access to healthcare facilities or better choices due to rising income levels. This study can encourage other tribes to adopt gambling on their reservations. Despite fear of decreased individual incomes and increased addiction and drug-related issues, the opposite has been observed: higher incomes and better health practices. And it's very important that the authors stress that it's this higher income that leads to these better health choices. And so this is my bibliography. I got some information from the National Impact Gambling Study Commission, as well as this is the source for my article. So thank you very much.